Hello and good afternoon friends, welcome to CEC-UGC live lecture. Dear friends, I am happy and delighted to announce you that we are carrying series of lecture on cancers, and when we are talking about cancers, we have introduced very good doctors from Delhi, and these doctors would be telling you on cancers. And I would delighted to tell you that today we have with us in our studios Padma Shri Professor P.K. Julka. He is Professor of Oncology as well as Dean in All India Institute of Medical Sciences, as well as I would like to tell you all that recently in 2013 he has been bestowed with the Padma Shri. As well as I would like to tell you all, he has almost 250 publications at both international and national level. He has authored a book named Becoming a Successful Clinical Trial Investigator. I hope that with his vast experience we would be learning more and more about cancer, because it is an introductory stage of this very topic. That is, as you know, that we are conducting series of lectures on cancer, so we are going to start from the preliminary stage. So first of all, I would like to welcome our guest Professor P.K. Julka to the EduSet lecture. Welcome to the EduSet lecture, sir. And I hope that all the students, all the viewers who might be watching us right now or would be watching us through YouTube later on would be benefited from this particular lecture. So over to you, sir.
Yes, good afternoon. I'll be showing you some slides also, because audio visual is much better than audio alone. That is what I believe in. And that has more impact on the public, on anybody who is listening to it. So what do we know about cancer? Cancer is an abnormal growth of cells, uncontrolled division of abnormal cells in any part of the body. If you see on the slide, normally cells grow from 2 to 4, 4 to 8, 8 to 16, like in a systematic manner. So if the cells don't grow in controlled manner, that is called a cancer. There a cancer is formed. Now if we see symptoms of cancer, what are the symptoms? There is unexplained weight loss, there is abnormal swelling or growth, but I must tell you one thing, that unexplained weight loss may be due to many reasons, maybe due to diabetes, there may be weight gain or weight loss, or maybe due to some other reasons also. But you have to be on the watch out if there is unexplained weight loss. Then abnormal swelling or growth, because if there is any abnormal swelling or growth in any part of the body, please show it to your doctor, because never neglect it. It could be a cancer, not that all swellings are cancer. Change in skin color, there may be change in the skin color. That means there may be change in the color of your moles. You know, everybody has moles on their body. There may be color change, and once there is color change or there is discharge from the mole, please show it to your doctor. Or difficulty in swallowing. If you feel that you could swallow solids or liquids freely, and suddenly you feel difficulty in swallowing solids first and then liquids, then again you have to be cautious, because cancer of the food pipe, that is esophagus, can lead to difficulty in swallowing. So cough is another, not that all coughs will be cancerous, because cough may be due to upper respiratory infection, may be due to lower respiratory infection. So cough, if it doesn't heal within 1 month, then you must show it to a doctor, because persistent cough could be a reason for lung cancer. Now, recurrent bleeding from any body part. This means that if there is bleeding from any orifice, we call it orifice because bleeding from nose, bleeding from mouth, bleeding from urinary orifice, or bleeding from stools. So any part bleeding, you must show it to your doctor, because this could be cancerous, or this could be, say, if there is bleeding in the stools, it could be colitis also. So, but you must rule out cancers in this situation. Now, then excessive night sweats, not that night sweats would be cancerous only, but it could be a part of cancer. Non-healing ulcer. This is very important because normally what people do, they feel that ulcer which is not healing, it may be due to some infection, some other things, but please don't neglect this because non-healing ulcer could be a sign of cancer. Now, I'll just show you top 10 risk factors for disease in 2010. Now, we used to say that air pollution, smoking, first-hand smoke or second-hand smoke, high blood pressure, childhood underweight, low fruit intake, pollution, high plasma glucose, alcohol use, iron deficiency, or suboptimal breastfeeding. All these were factors because earlier we never used to listen of cancer about, now you are seeing the slide, top 10 risk factors for diseases, various diseases. Now, if you see on your the left side, you see top killers across the world. They used to be high blood pressure, household air pollution, then high body mass index, that means obesity, fatness, and then high plasma glucose, that is diabetes, air pollution. Today only you must have read in the papers about air pollution. So air pollution is very disastrous. It can lead to lung cancer, it can lead to bladder cancer, and high cholesterol and low mineral density. But death due to dietary risk factors, disease attributable to tobacco smoking, alcohol and drug use. So what I want to tell you that there is a paradigm shift. What do we mean by paradigm shift? Earlier we never used to hear of cancer related deaths. We used to say death is due to diabetes, due to high blood pressure, or due to heart attack. So now there is a paradigm shift that cancer is taking major scenario, Now if we see the cancer scene in India, what is the prevalence? Prevalence means at any time how many cancer cases are there. There are 30 lakh cancer cases at any given time. And incidence is 11 lakh new cancer cases per year. So you can imagine how many cancer cases we are getting. And deaths are 6.3 lakhs per year. And age group is 60 to 70% is in 35 to 64 years. Now here I must tell you that in the West, cancer is 1 decade later. And here in India, we get all the cancers 1 decade earlier. That means 10 years younger. Because people say that our lifespan is short, it could be the reason, or genetics could be the reason. Then tobacco related cancers are 40%. Now you can see if 40% cancers we can prevent by simply banning tobacco or simply not using tobacco in your daily life, then you can avoid cancers. Not that non-users will not get. Non-users may also get, but tobacco users are more prone for cancers. Now 2/3 of the cases are in advanced stage at the time of diagnosis. Now we always say that cancer presents in advanced stage where we hardly can do anything, but still we treat them as a palliative treatment, we call it. Now the other thing is common cancers are breast, uterine cervix, oral cavity in females, oral cavity, lung and esophagus in males. Now if you see the cancers in male, lung cancer, stomach cancer, this is from one of the cancer registries. We are seeing lung cancer, stomach, prostate cancer is coming up because as we are getting more westernized, prostate cancer is coming up. Then esophagus, food pipe cancer, lymphomas, head and neck cancers, brain tumors, cancer of the tongue, colon and rectum. And if we see in females top 10 cancers, which are the cancers? Now you see Delhi, if you are seeing the breast cancer is number 1 in all the cancer registries except for Barshi, which is a rural registry. That means we are living in metropolitan cities and we are more prone for breast cancers, especially in females. Now, breast cancer is common, as you are seeing in Delhi, it is 31.4 per 100,000 population. We call it per 1 lakh population. And in Ahmedabad it is a little less. In Chennai it is 33. In Bangalore, if you see, it is 30.9. So these are the latest figures. So you see breast cancer tops in almost all the cancer registries except in Barsi, which is a rural registry. Now, if we see that you see in the next slide, causes of cancer. Now, what are the causes? We always say infections are the causes. Tobacco chewing and smoking are the causes. You know, we always say smoking, bidi, cigarette are the causes, but non-smoking also can get cancer due to tobacco chewing. We call it smokeless tobacco. Smokeless means where there is no smoke. Alcohol, if you take, it is worse. It is a synergistic action. Alcohol with smoking, you are more prone for cancer. Unhealthy lifestyle. You don't do exercise, you don't take proper diet. That also leads to cancers. There are genetic causes, which I will be telling you about certain genes. For example, BRCA1 and 2. And there are various types of genes. For example, there are oncogenes, which cancer producing genes, which are called, and there are tumor suppressor genes. They are present in all individuals. So if oncogenes, the genes which cause cancer, are more prominent, they cause cancers. But tumor suppressor genes, if there is mutation or there is difficulty in genetic makeup, then it causes cancer. For example, BRCA1 and 2, which lead to breast cancer. Now, there are certain chemicals, polycyclic hydrocarbons, which cause cancer, and there are certain unknown causes also. Now, if you see one by one, the infection-related cancers, they are cancer of the cervix. Cervix is lower part of the uterus in females. Head and neck carcinoma, head and neck cancers, oral cavity, neck carcinoma, larynx, pharynx, upper part of food pipe, upper part of voice box. Then hepatocellular carcinoma, which is liver cancer, lymphomas, which is all the lymph nodes, nasopharyngeal carcinoma, which is behind the nose, and maltoma, which is in the stomach mostly. And the viruses responsible are HPV, HBV, hepatitis B virus, hepatitis C virus, and EBV virus or H. pylori. Now, if you see this Professor Harold Zorhusen, why I am showing you this photograph, because he got Nobel Prize for discovering the HPV virus. HPV is human papilloma virus, which causes cancer of the uterine cervix. But now lately we are finding that this can also lead to cancer of the tongue, back of the tongue, which is called oropharynx, oropharyngeal cancers. Now, if we see epidemiology, the human papilloma virus, HPV infection, is most common STD worldwide. STD means sexually transmitted disease. Most sexually active individuals of both sexes will acquire it during their life. Average prevalence of 10.4% is higher in women younger than 25 years, and type 16 and 18 responsible for 70% of the cervix carcinoma. So that means HPV type 16 and 18 are responsible for most of the types, and we have now the vaccines also. In 2005, there were about 5,20,000 cervical cancer cases in the world, of which 4,43,000 are in developing countries. You can imagine the ratio. And in India, it would increase by 0.11 million in the year 2000 to 2010, that is 0.16 million cervix cancer cases. Now the proportion ranges from 15 to 55% of females cancers from different parts of the country. But this is more common in a lower socioeconomic strata people. Over 80% of cervical cancer present at fairly advanced stage, and around 80,000 deaths are reported due to cervical cancer in India. Now, if we see tobacco-related cancers, now you must be wondering, we have 40% of the cancers which are tobacco-related. So that you can do primary prevention. That means don't stop taking tobacco right from today, and then you can avoid these cancers. These are head and neck cancers, lung cancer, esophageal food pipe cancer, gastric cancer, which is stomach cancer, bladder carcinoma, prostate cancer in males, and breast carcinoma in males and females, and acute myeloid leukemia. Even leukemias can occur due to tobacco. And this is not only due to tobacco smoking, this may be due to smokeless tobacco also, especially head and neck carcinoma. Now tobacco, India is the third largest producer of tobacco, second largest consumer of tobacco in the world. That means 57% of the men and 10.8% of women smoke. And according to the GYTS 2009 study, 14.6% use tobacco. This is young tobacco smoking campaign. This was in the year 2009. This was done, and we found that 14.6% of the young people also use tobacco. So that is why we say you target school population, especially from 9th onwards, that they should not use tobacco, because once they see their film star smoking, or they see their hero smoking or heroine smoking, then they start using tobacco. Large percentage of youth are vulnerable to tobacco use. Various forms of tobacco, smoking and smokeless tobacco products in use. Now there was a legislation that 100 meters around the school area there will be no sale of tobacco, but it is not being implemented, because still we find near the school children are slowly going on for tobacco use. And if they use tobacco and hookah parlors, then they are more at risk of developing cancer any time in their life. Now, if we see the scientific evidence, disease and smoking, you see the besides cancers all listed on one side, and the other side you see other diseases like stroke, cataract, coronary heart disease, and atherosclerotic peripheral vascular disease, aortic aneurysm. These are all diseases, and disease of the lungs. So all these can also occur. Even sterility can occur. You won't be able to reproduce if you are using tobacco. So this is very dangerous situation where we are going to. And what are the constituents of tobacco smoke? It has poisonous gases, then it has chemicals like benzene, formaldehyde, polonium-210, which is a radioactive isotope, lead, chromium, cadmium, arsenic, and there is carbon monoxide, which is very dangerous, butane, toluene, ammonia, hydrogen cyanide. So these are all poisonous gases. These are chemicals. So these are toxic metals, if you see, and they can lead to cancers. Now, if we see tobacco, in males, tobacco users are 57%. In females, they are relatively less, 10.8%. But in rural areas, we find ladies smoking bidi. So that is also dangerous. Smokers, if we see in males, are 32.7%. And then out of the total tobacco users, 32.7% are smokers, and chewers are 36.5%, because India has more chewing population, especially in the states like Uttar Pradesh, like Bihar. They generally use khani, zarda, all these which are smoked pan masala, full of tobacco. Now if we see smoking, cigarette, bidi, hookah, chutta. Chutta smoking is like they put burning end of the cigarette in south, in some areas in Karnataka, they put burning end inside their mouth, and that is called chutta smoking. Chilam, cigars, gutka, khani, zarda, these are chewing. All these pan plus tobacco, gul and mawa, misbri. So all these are mishri. They are all tobacco chewing, and they can also lead to cancer. Chewing tobacco is 30%, bidi is 54%, and cigarette is 18% according to the various statistical figures. Now here we see all the, we call it a masala, which is like people chew, pan masala and all these, and these are chewing tobacco. Now who smokes more, male versus female? If you see the world population, the males are smokers, more smokers than the females. You see the red area. And this is to show you how the tobacco enters the lung and it causes cancer of the lung. So lung cancers, 90% of the lung cancers are due to smoking. So you can imagine that not that non-smokers will not get lung cancer. Non-smokers get lung cancer due to genetic defects, but smokers get lung cancer, that is due to smoking. And smoking has, as I showed you, tobacco has carcinogens, more than 40 carcinogens and more than 400 chemicals which can lead to cancer. Now, not only smokers can get cancer, but passive smoking. Passive means that who is in the room, if one person is smoking, the other persons are inhaling the smoke, and passive smoking kills 600,000 people worldwide every year. So you can imagine the passive smoking is also killing people. And there was a recent WHO study in which they showed that smokers' wives are more prone to cancer than other ladies. So this is a live example of passive smoking. Don't allow anybody to smoke in your where you are there, or in your office, or in your place of work, so, or at home also, because best is to teach children not to allow their parents smoking. Now we always say smoke kills, and smoking kills. The smoke from your cigarette harms people around you. You see here, even in films we see that person is smoking and putting the smoke on others, and this is just to showing you love and affection, but this is not love and affection, this is killing somebody. So then due to smoking we have these lesions. I am just showing you a few lesions. This is called submucosal fibrosis. Now you see a person cannot open the mouth fully because his mouth is fibrosed, and his mouth is fibrosed due to tobacco smoking. This is called submucosal fibrosis. You can hardly put 1 or 2 fingers inside the mouth, and on your other side you are seeing the lesion, white patch. This is called, white patch is called leukoplakia, pre-malignant lesion, and then we have black patch, erythroplakia. These are precancerous lesions. And here you see that there is another cancer area. You see how much cancer, big lump or swelling on the tongue. Tongue cancers are also very common in smokers, and this is how it looks like. Now this is again a cancer of the lower jaw, where you see due to smoking the entire teeth have gone away, and they will come out, and the cancer is in advanced stage, and the person will have swelling in the neck. Now you see another type of cancer which is in the lips. These are all tobacco related cancers, and I must tell you that tobacco related cancers can occur any part of the body, especially this is chewing tobacco, can occur in head and neck area. Now if you see the real world advertisement, if you see the advertisement here, a girl is smoking, but in reality we have seen who are patients who are addicted to smoking, there is a small tube put in the larynx. This is called tracheostomy, and from the tracheostomy scar also tube, that person is smoking. He says, let me smoke till I die, because he cannot leave smoking. This is called addiction. But addiction can be taken care of if you have strong willpower, and if you are willing to leave the smoke, you can still be at a lower risk of developing cancer further on. Now lifestyle cancer, which is, we call it, cancer is a lifestyle disease. What are the changes in lifestyle which we know that could lead to cancer? Now first of all, I must show you that in Western Europe, this first line is the line of incidence and the middle line is line of mortality. Here you see in Europe incidence is very high, but mortality is very low. Mortality means less people are dying from the disease. As you go down the graph, you see in Asian population, less developed regions, the incidence and mortality go parallel. That means more people are dying of disease, dying of cancers than the incidence. Now here you see risk factors for breast cancer. If we see, they are multifactorial. One is gender. Gender means females get more breast cancer than males. Males also get breast cancer, but it is 1% of all breast cancers. Age, as the age advances, not that younger people will not get, as the age advances, they get more cancers. Family history, this is very important, as I was telling you about mutations in tumor suppressor genes. The genes which suppress the tumor, BRCA1 and 2, if they are mutated means they have, some abnormality in the genes. Family history of breast cancer is there, and the breast cancer goes from mother or grandmother to grandchild also. So we always ask about family history. If your mother or mother's sister or anybody from mother's side or even father's side has breast cancer, then you are more prone to get cancer if you have mutation in BRCA1. But you may not, all may not have mutations, may have some other mutations in other genes. Then there is early menarche and late menopause. The girls which have started menses early, that is called early menarche, and where menopause is very late. For example, a girl starts menses at 12 or 10 and then goes on till 50 years. So menopause is late. That means that girl or woman is exposed to female hormones for a longer time. So that means she is more prone for breast cancer. So breast cancer, the major culprit is female hormone estrogen. Then some people taking hormone replacement therapies, which are full of estrogens. So if they are taking more estrogens, then they are more prone for breast cancer. Then there are genetic syndromes associated with it. Then dietary habits. If you take junk food, more junk food, and you are getting obesity, as you are seeing, then you are more prone to get breast cancer. And if you are doing no exercise, sedentary habits, and you are taking junk food, that means high fatty diet, then you are more prone for breast cancer. Then breastfeeding, if you are not feeding your child, that nowadays because of the Western influence, lifestyle changes are taking place, and people are feeling that breastfeeding would spoil their image. So that also non-breastfeeding can lead to breast cancer. Then parity and childbirth. Parsi population in Bombay, they don't marry at all, or they marry and have children after the age of 40. That also can lead to less number of children or no children can lead to breast cancer. Now, not that you must have one after the other child. So that is also bad, because that can lead to multiple pregnancies and can lead to cervix cancers. So the first childbirth should be before the age of 30 to avoid breast cancer. Now, if you see, there are modifiable risk factors, there are non-modifiable risk factors. Non-modifiable means gender you can't change. You can change nowadays, but we always say it's a non-modifiable. Gender means you are a female, elderly age, personal cancer history, that means you have a history, a family history of cancer, genetics is playing a role, early menstruation and late menopause, as I showed you. Then your breast density is high. If the breast density is high, you are more prone for breast cancer. Then breast conditions, there are certain benign breast diseases which can lead to breast cancer. Then there are modifiable risk factors. Modifiable means body weight, physical activity, alcohol use. Body weight means you have to control your weight. You can't put on weight every time. Physical activity must be there for half an hour daily, and that means maybe brisk walking. You need not go to the gym every day. You can do brisk walking. Alcohol use should be avoided. Smoking, as I showed you, should be avoided, and exposure to hormones unnecessarily should be avoided. Only after consulting your doctor you can use these hormones. Pregnancy and breastfeeding. Pregnancy should be before the age of 30, and breastfeeding must be done for all children. Then radiation exposure. If you have been exposed to your radiation, don't get your chest x-rays done every now and then. You have mild cough, you should not go in for chest x-ray. This is very dangerous because x-rays also have radiation, and CT scans have more radiation than your x-rays. These are modifiable risk factors because you can avoid this. Now we come to prevention of cancer. How can we prevent cancer? Eliminate or prevent pre-invasive disease before invasion occurs. That means there are pre-invasive, as I told you, there are pre-invasive cancers, breast cancer I told you, some benign breast diseases which can lead to cancer like atypical ductal hyperplasia. There are certain diseases which are benign, not that fibroadenomas don't produce cancer, they can produce cancer later on, but you should avoid. Now for example, carcinoma in situ, or I showed you in the mouth, erythroplakia. You must show it to your doctor, or leukoplakia, white patch or colored patch in your mouth. Show it to your doctor because this is pre-invasive, before the invasion develops. And after the invasion develops, then of course you have to treat. And now another thing is general health maintenance. Eat a healthy diet, don't smoke, don't drink, and exercise and maintain optimal weight. So this is very important. General health maintenance, eat a healthy diet, don't smoke, no smoking, no drinking. You can stop it right from today. And exercise, do optimal exercise and maintain your weight. Surgery is used for preventing cancers in some cases. As you know about Angelina Jolie, Angelina Jolie effect was there because she got her both breasts removed because she had BRCA1 mutation. Because she could get breast cancer, she could get ovarian cancer. So some people get surgery done for this purpose. And there is some chemoprevention. There are certain drugs used for chemoprevention who are at high risk. And this is general health maintenance. Maintain a healthy diet. We always say take a balanced diet. No smoking, no drinking, and optimal weight has to be maintained. And social change is difficult and takes a long time. This is what we say, and not good enough in high-risk people. So I must show you that breast cancer screening is not possible in our 1.2 billion population. You can do breast self-examination if you find a lump, or get it examined by a physician. And there are mammograms. Only you do mammogram, don't go by yourself. Always go to a doctor. If he prescribes, then only get mammogram done. And breast self-examination, this is just to show you, you can examine your breast by yourself with the right hand left breast, with the left hand right breast. Although these studies don't show them to be effective, but in our population, I think this is more important. Then clinical breast examination by a doctor, by a trained doctor or a trained nurse should be done, preferably after the age of 30, and after the age of 20 you could do a self-examination. And then after the age of 40, at the discretion of doctor, go in for mammograms. So this is mammogram, but in Western countries they always say from 50 years onwards you should get mammogram. If there is a family history, from 40 years onwards. Mammogram also has a risk of radiation. Now there are various views. This is to show you mediolateral or craniocaudal view. Some people feel pain in mammograms, so we can do ultrasound also, but that is not a total replacement for mammograms. So breast cancer screening summary, the US Preventive Task Force, they always say that you start at the age of 50 and get mammogram, screening mammogram 1 to 2 years, but this does not hold true for our population. You should go to a doctor and he or she should tell you when to get mammogram done. Carcinoma cervix, similarly, this is a busy slide. You may not be able to read it carefully, but I must tell you that screening for carcinoma cervix, you must get your pap smear, or nowadays we are doing HPV DNA. HPV is the main source cause of this cervix cancer. HPV DNA, once it is done, then you are free for 3 to 4 years. You can get it done later on. And pap smear once in 2 years you can do it to avoid to get pre-invasive carcinoma detected. Now then we have vaccines in carcinoma cervix, which is quadrivalent and bivalent, that means against the 4 varieties of HPV and against 2 varieties of HPV. Then we have the surgery for cancer prevention, as I told you, breast cancer, colorectal and cervical cancer. Pre-invasive lesions you can go in for surgery so that cancer does not develop. And management of high-risk conditions, these are certain conditions where we can manage with surgery. Now cancer chemoprevention, chemo means giving of chemicals, pharmacological compounds. For example, tamoxifen, we give it for chemoprevention that can prevent the breast cancers. Success intelligence, breast cancer, we have tamoxifen. Prostate cancer, we have certain drugs. Colorectal cancer, again certain drugs. And women's health initiative. Cervical cancer, we have vaccines. And here you see the treatment is multimodality approach. That means radiation oncology, the medical oncology, the surgery, all combined together, and then imaging and screening, and then palliative care, all they combine, nursing, all combined, and public health policy, all should combine together to treat a cancer patient. And supportive staff also should be there. So this is called a multimodality approach. Now cancer care at various levels. We have the primary health center, we have the secondary health centers like community health center, where early detection can be done, because Anganwadi workers are being trained to detect early breast cancer, or say you can see the mouth, you can do self-mouth examination also, and district hospitals are there for cytology, and tertiary cancer centers, of course, we have 29 regional cancer centers for treatment, and it should be a combined effort for all, as I told you. Thank you very much for listening to our talk, and if you have any questions, I will be most happy to answer.
Definitely, sir. It was one of the most productive lectures because we try to bring for all the students, all the viewers who watches us, that some productive content would be delivered. Now the question arises here, as I have come to know that you have performed first peripheral blood stem cell transplantation in India in the area of the breast cancer. I would like to know through you, sir, what is this cell transplantation?
Nowadays, actually, what we say that there are two types of, like, autologous transplant and heterologous. Heterologous means allogenic, means from a different sibling, which we call it HLA matched. You know, you do the blood group matching and then do the transplant. But this was early 90s, because that time we didn't allogenic, and this was not known for breast cancer, for solid tumors, because we wanted to try for solid tumors in a patient who was treated with all the modalities, and that time we didn't have enough drugs also. So this was being tried, but nowadays people don't do for solid tumors. They are doing mostly for leukemias and lymphomas, and mostly they are doing allogenic, that is bone marrow transplants. And stem cell transplants are you that give chemotherapy, destroy the cells, take out the blood, and then first you give growth factors so that our stem cells come from bone marrow to the peripheral blood, and then you can collect the blood and then reinfuse the stem cells.
As you yourself through the slides presented that how breast cancer, the cases of the breast cancers are very high throughout India, if you talk about. Sir,
yeah, this is #1 cancer in the females now.
Now, and is it, if we compare with other cancers also, it is the one with which the women are mostly affected?
Yeah, most of the women, you know, now today only out of say 100 cases, we found that breast cancer formed 50% of the cases. So it is such a prevalent now, as I showed you the prevalence also, because this is a lifestyle disease. We always call it a lifestyle disease. Why lifestyle? Sedentary habits, not you know, taking proper diet, taking fatty food, and then going in for all these, you know, smoking, going in for alcohol, pseudo-westernization I must call it, not true westernization. We must take good things from the West, not take bad things from the West.
Sir, when the mother doesn't feed a baby, could it be a reason for the breast cancer?
Yeah, we always say that those who don't breastfeed, ideally they should breastfeed their children, maybe for 6 months, 1 year. All the children, maybe 2 or 3, whatever children you have, they all must be breastfed, because breastfeeding is known to be a protective factor for breast cancer. That is why we say that female hormone estrogen, that is the culprit. And as I told you, there are certain non-modifiable factors, means if you have early menarche and late menopause, you can't do anything. You know, this cannot be modified. But your weight can be modified, your exercise can be modified, and your junk food can be modified.
Exactly. Certain things are in our own hand and certain things are not.
Yes.
Exactly.
Certain things are not.
Somebody some days back said me, because women works more in the kitchen and they are more exposed to the flames, is one of the reasons for the breast cancer.
Now, no, that I'll tell you one thing, because you put a very good question, because in Northeast, the cancer incidence is much more. Why? Because they live in one room and they cook also there. With the old angitis, you remember angitis used to be, I don't know whether because children must not have seen nowadays, because the whole fumes, they come up and they are living in that room only, and they are also eating in that room, and they get more smoke and they get more cancers. So smoking, as I told you, that adds to all these factors.
If a mother is suffering from certain kind of a cancer, could we say that yes, the daughter or the son would be likely to get cancers in the future? Yeah,
that is very important, because once a mother has a cancer, has a breast cancer, for example, then we always say you must get yourself checked up, and your daughters, your sisters, you must get them regular checkup done. But Angelina Jolie, she was too, you know, we can't imitate her. You know, like removing both the breast, remove. If BRCA1 gene is mutated, then some people are more, afraid of this. So don't be afraid. You go for regular checkups, and then of course once you find any lump anywhere, and once you are going for a checkup and the doctor detects a lump, he will get everything done. So don't be afraid of that.
But definitely, as what Dr. Julka has said, if you are not afraid and you take measures in advance, measures in this sense, if you go for the regular checkup, it would be beneficial for you. Since many years, not many years, but recently we have been hearing more about this genome theory, that with the help of the genes it could be predicted that in future one could get be affected to the cancer. Is it true, sir?
Yeah. Now we have come to the molecular level. In 70s, when we were students and then later on residents, what we used to see, absolutely no hearing of these genome theories. 80s, 90s, nothing. In 90s we started hearing of this genome theory, and then molecular basis of cancer is coming up. In almost all the cancers we are getting molecular classification of cancers. What is molecular classification? That, for example, in lung cancer, if one gene is mutated, EGFR, we call it mutated, we give them tablets, simple tablets, no need of chemotherapy. Now, similarly in breast cancer, if stage early, T2, M0, T2 we call it 2 to 5 centimeters, 3 centimeter tumor, whether to give chemo or not, we can have genetic test. Not that we depend on 100% on genetic test. Clinical plus genetic, we should say that this is whether you need chemo or not, then we can decide. So this was never there earlier. So we have genetic tests like Oncotype DX, we have PAM50, 50 gene signature, 21 gene signature, 70 gene signature, all these we are getting it done.
So if somebody is prone to the cancer in some part of the body, but successfully he recovers from that cancer, are there any chances that the person is likely to get cancer again?
Yeah, this is also very important, because we always say that treatment is important, but follow-up is more important than the treatment. Why? Because you see the recurrence early, if there is a recurrence. Not that all people are going to recurrence. There are certain cancers which are aggressive type of cancers. So they get more recurrences, either locally or systemically. Systemically means they can get recurrence, for example, breast cancer. They can get recurrence in the lung, they can get recurrence in the brain, or they can get somewhere else. So local recurrence plus systemic disease can occur anywhere in the system, bones, liver, lung, anywhere in the body. So how can we detect it? Unless and until a patient doesn't come to us. If a patient, we always say, you come after 3 months, you come after 6 months, later on 1 year. So why do we call them regular follow-up? Because to detect early disease. If early disease is detected, then we can cure them. Then there's no need of worrying.
Exactly. Sometimes it is also seen that when a patient goes to a doctor and when the cancer is detected, sometimes doctor prefers that yes, you can go for the chemos or for the operation kind of thing, but sometimes doctor refuses and says that if chemo is given or some operation is given on that part of the body, it will reduce the span, that is the lifespan of the patient. Is it true?
No, this is not true. Because once you go to a doctor, he will tell you the optimum treatment. Suppose there is a lump in the breast. Now, whether to remove the lump only or to remove the entire breast, that we discuss it with the patient, and we tell the patient that these are the consequences. If you remove the lump only, you have to have radiation. This is a must. We call it a breast conservation therapy. So after removal of the lump, that means after surgery, you have to get radiation therapy, and then chemotherapy or hormone therapy according to your, again, molecular profile. Which molecular profile? We do hormone receptors, ER, PR and HER2 gene, and then sometimes we do Ki67 also, which is a proliferation marker. So we see how much aggressive is the tumor, and as the tumor is more aggressive, then we go in for the chemotherapy. And otherwise, if hormone receptors are positive, we go in for hormone therapy. So this will depend on your molecular profile.
Sir, you use the term the growth of the abnormal cells. If we talk in the common terms, that in the words of the layman, what are these abnormal cells?
Yes, no, what I was trying to say, that normal cells, how do we grow? From a child, small child, a person grows into a big man. How does he grow? Because our cells, they multiply. They multiply in an organized manner, systematic manner, organized manner. As I showed you, 2 to 4, 4 to 6, 6 to 8, 8 to 10. There's a system of multiplication. If it is disorganized, haphazard growth of cells, then it can lead to growth somewhere. It can lead to ulcer somewhere, ulcer in the mouth, or growth, say lump in the breast, or lump in any part of the body, or any growth anywhere in the body. So this is called cancerous, and there are two types of growths. We call them benign and malignant. Malignant is called cancer. Benign is a benign tumor which is non-cancerous. And sometimes we have to do surgery, remove the tumor, and then find out, because another myth is there amongst people, that if you do a biopsy, the tumor will spread. So this is a big myth which I want to clear today, and I have been clearing in all the TV shows, that after doing a biopsy, the tumor never spreads. Biopsy is a must for almost all the tumors, because histopathology diagnosis under the microscope is 100% true.
Sometimes it is also seen that some people are prone to certain kind of infections. Those infections grow from time to time, they heal up also, but the intensity and regularity of these infections, they keep throughout the life. Person should take these things into concern and should take them very strongly?
Yeah. Now HPV infection, as I was talking about, human papilloma virus. Now you see, human papilloma virus, Professor Zorhusen, who got the Nobel Prize, I showed you the photograph also. He showed that this causes cancer of the cervix, uterine cervix. Lower end of the uterus is called cervix. Now, how does it occur? This is a sexually transmitted disease. If you have multiple sexual partners, you may get this disease. Now, the most important thing is that in the West, they found that oral, behind the tongue is oropharynx. They can get cancer of the oropharynx. How do they get that? This is again due to lifestyle. Oral sex, which is more common in the West. It is not common in India, but still we are getting 20 to 25% cases of oral cancers which are HPV positive. So that is what I mean to say. You should maintain a healthy lifestyle, do exercise daily, no smoking, no drinking, absolutely. If you can do like this, I think you can avoid cancers in most of these situations.
Definitely. I hope that all the viewers, all the students who might be watching us would be incorporate all what you have said in their lives. And now another question for all the women who might be watching us, that could late marriages be the reason for all the cancers among women which are prevalent?
One of the reasons for breast cancer, we always say that late marriages, as we saw in the Parsi population in Bombay, they don't marry at all, or they marry very late, because if they marry late, they would have children late. So that could be one of the reasons, besides genetic reasons, could be one of the reasons for breast cancer. So that is why we say, follow the rules of nature. As you go against the nature, you will feel difficulties.
Definitely, sir. Very right said. And one of the another cancer which is more prevalent among women, as it has been seen through recent years, that cervix cancer is on the high. So I've heard that there are certain vaccines. If
yes,
one go for those vaccines, are very helpful.
I showed two of the vaccines, Cervarix and Gardasil. These are two. One is bivalent vaccine, one is quadrivalent, means against 4 strains, and one is against 2 strains. If you get the vaccine early, then you can prevent yourself. But what I must tell you, that if you have a healthy lifestyle, one life partner, and then don't indulge in other sexual activities, so safe sex, then you cannot have cervix cancer. So that is what I want to tell you. Another cancer which is most common in females nowadays, we are seeing gallbladder cancer, which is along the Gangetic belt. And we still don't know what is there in the Ganges. We want to analyze what is there and do the molecular profile of patients who are getting cancer of the gallbladder. So, but we are attributing it to stones also. So, if a person has stones, we tell them to remove the gallbladder. So, that is why.
That is the concern, sir, because as we have less time left, and as you yourself has stressed more on the lifestyle as well as the eating habits. Now, last but not the least question from the very section of ours, that is the lifestyle. Do you feel so that our eating habits with the passage of time has been changed, as you yourself said, because of lot of junk food, especially this, which is very prevalent among the students, could be the cause of...
that could be the cause, because junk food is leading to obesity without giving you any proteins, carbohydrates, and giving you unnecessary fats. So putting on fat also is dangerous, because why put on weight? You know, if you can control your weight, do exercise regularly, don't smoke, don't drink, put a healthy lifestyle, you know, eat healthy diet, don't eat junk food, then you can avoid cancers to a majority of extent.
Sir, if we take into consideration that we should keep our immunity level always strong, could it would be easier for us to resist against the diseases?
Yeah, definitely, because nowadays immunotherapy is coming up again. Immunotherapy means we are raising the immune status of our cancer patients or doing immunotherapeutic approaches. Certain monoclonal antibodies are there which can raise our immune status. You know, so this is why if your immunity goes down, then only cancer cells can overpower you. You know, enemy is cancer, and to attack the enemy, you should attack with full-fledged sword. You know, so full-fledged attack we call it. So what you should do is to raise your immune mechanism, and how to raise your immune mechanism, how to improve your immunity is through eating right, doing exercise, no smoking, no drinking, and that is why healthy diet can improve your immunity.
I hope that all the students who might have watched us or would be watching us through YouTube later on would be watching us again and again, because I believe, and it's my firm affirmation, that what Dr. Julka has given to us through this lecture is very beneficial. If we incorporate all his points into our daily lives, our life would be healthy and easy. With this note, thank you, sir. Thank you so very much for being the part of the DSET lecture, and I hope that under his able guidance we would be able to carry more lectures. So once again, thanks Padma Shri Professor P.K. Julka for being with us on our DSET lecture. Thank you, sir. Thank you.